Good afternoon, everybody. This is Dr. Distano from Distano Chiropractic and Rehabilitation. Today I would like to talk to you a little bit about vomit. Yes, vomit. Now, it's not the vomit that you may be thinking when you hear that word. It's actually the acronym that we in physical medicine and rehabilitation actually use, and it stands for Victim of Medical Imaging Technology. Now, this is very important and a common question that I have, and I get emailed all the time from prospective patients, and actually asked this frequently by patients that come in the office. Do I need an x-ray or an MRI for my back or neck pain? And most of the time the answer is no. Despite the severity of pain that you are in, that you present to our office with, doesn't always mean you actually need an x-ray or an MRI immediately. There's very certain strict guidelines that we follow when deciding if we should actually prescribe an x-ray or an MRI to patients. And that mainly is based on if we feel like the patient has instances such as tumor, infection, fracture, what we call red flags. Now, we are highly trained to recognize and rule out red flags as part of our training. And fortunately, more than 90% of the time, those red flags are absent. So the majority of cases, people could begin treatment instantly despite the severe amount of pain that they are in. Actually, getting imaging too soon in the course of care is harmful, and studies have shown that early imaging of an x-ray or an MRI, when it's not appropriate, when we don't suspect any of those red flags taking place, leads to patients having worse outcomes, so prolonged pain, disability, and actually they're more likely to get surgery because the imaging, the x-ray or the MRI, is likely to show normal degenerative changes that everybody over the age of 20 or 30 will have to some degree. Degenerative discs, spinal stenosis, disc bulging, even disc herniations as far as the neck goes. In the shoulder, there's rotator cuff tears that could be present. Doesn't always mean that it's correlated with your pain. Most of the time, pain is mechanical. That is, it varies with certain movements or positions or postures, and other times it doesn't feel too bad. If the pain strictly was coming from the finding that was on the imaging, it would be constant. You don't just some days have a bulging disc or stenosis, other days you don't have stenosis or a bulging disc. The rotator cuff, tear is always there. Some days you don't have a rotator cuff tear, some days you have a rotator cuff tear. No, if it's there, it's there. But just because it's there doesn't always mean that it is relevant and contributing to your findings. So the long and short of it is, don't be a victim of medical imaging technology. Get a thorough evaluation by a qualified clinician. If you don't have those red flags present, then do not get an early x-ray or an MRI. Thank you for listening. Have a great day.